Hi guys, I'm Heather. Welcome to the nursing channel. I just want to give a shout out to Steven and say thanks for creating this channel. It's such a great idea and I'm really looking forward to collaborating with my YouTube nursing colleagues Renee and Nicole, Steven, Ty, Brittany and Robin, where we can all share our different nursing experiences. Hello to you all and hello to the viewers. Thank you for your support. We all really appreciate it. So a few little secrets about myself. I graduated nursing school in 2002 in Southern California with my associates. I worked in Southern California in many different hospitals, and I traveled through the U.S. in Washington State, Nebraska, and Vermont for a little West, Midwest, and East Coast nursing. Nursing is my passion, and I love it so much. I actually look forward to going to work some days, and on my days off, I actually miss it. I know it sounds crazy, but it's true. So Robin, hey Robin, she asked me in one of her videos, how do I deal with going to different hospitals, and do I mix up protocols, and how do I cope with learning the ways of a new hospital? And that's a good question. When I first decided to go to different hospitals on a daily basis, I thought to myself, well, doing nursing skills and duties is going to be the same everywhere. Putting in an IV, an NG tube, a Foley, that's all the same no matter what hospital you go to. I know how to give meds and do assessments and when I need to call the doctor and be a nurse. One of the biggest struggles I face is like finding out where everything is. I can walk into a clean utility room and finding a Band-Aid in a bedpan is challenging. And it's the biggest time waster. And also finding out what doctor to call for what, because I don't know who the heck anybody is. Some hospitals use computer charting, which can be a nightmare, but once you get used to it, it's fine. Just show me what and where I need to chart, and I'm good. Of course, I'll always have questions, but that's to be expected. Hospitals do have different ways of doing things for sure. Like in nursing school, I was taught to hang a K-Rider, which is IV potassium, as a piggyback. And at one hospital I went to, they actually ran NS at 50 concurrently with a K-Rider. And that's the first time I had ever seen that, which makes sense because IV potassium is so irritating to the veins, it's probably good to dilute it even more than normal saline. Okay, so in all my years of nursing, I was always taught and I always red-bagged blood bags and blood tubing, right? Do they still do that today? Because at this hospital, I was looking for a red bag, so I asked another nurse and he's like, oh no, just throw it in the red trash can as it is. And I was shocked. I thought he was kidding and pulling my arm, and then I looked into the red trash can and nothing was red bagged. And get this, the IVs, they throw them away in the trash can instead of the sharps container. Never seen that before. I don't know if it's a new thing or what, but I was like amazed. And at another hospital I went to, they didn't allow you to tube pretty much anything that wasn't an MRSA swab. So we had to carry down the urine and feces and whatever else down to the lab ourselves, which is like the biggest waste of time, right? I mean, why can't we tube it? So little things like that are done differently at hospitals. When I go to a new place, I try and ask, how they do this certain thing, because you never know. So on to the weekly topic of what happens when things don't go your way and where do I start? Because that's like every day at work. And that's what I love about nursing, because you get like a patient surprise every day. And not that everything that happens is a nightmare. Some are like small issues and some are bigger issues. Most days are cool and under control, where the patients are calm and cooperative and not much crazy is going on. But sometimes you have a bad day that sneaks up on you and pounces on you like a tiger and bites you in the you-know-what. Sometimes there's like a million things to do at once. Everyone wants a piece of you at the same time. Adverse things happen with patients that cause you to swerve off course and then throws you into a 5-car/patient pileup. Or something happens close to change of shift and you have to stay over and finish charting or finish whatever you couldn't finish. There are some days that I've stayed at work until 9:30 p.m. Not cool. I received a patient from Cath Lab one evening, and I was pretty new to the cardiac world of nursing. And this patient came up with a pressure device on his groin called a StarClose. And it's a plastic bubble filled with air. This device is used to prevent bleeding after a heart cath and being stuck with like a big catheter needle. So shortly after this patient comes to the floor, his groin starts bleeding and the StarClose is leaking and it needs to come off. So I take it off and I hold pressure, and I could barely see where I needed to hold pressure because it was bleeding all over my hand. So I asked somebody to get me a nurse that I knew was experienced with post-cath lab patients because she would know what to do. So we called IR and they came up and tried to put the StarClose device back on, and it wasn't working because it kept filling up with blood. So we had to take it off and hold manual pressure and sandbag it for like 30 minutes or so. Eventually he stopped bleeding, and I haven't had an incident like that since, but the great thing is we don't work alone. Yes, we are given patients that we're primarily responsible for, but there's always another nurse who can help out in a time of crisis. Thank God, or I would have been in trouble. And since this incident was close to the change of shift, I had to stay over and finish my charting, which is totally against my main goal of getting out on time. I don't care what's thrown at me during the day. I just want to get out on time. 12 hours is a long shift, right? So when these situations surface, do I get stressed out when I'm thrown off schedule? Of course, but only for 5 minutes, and then I gotta slap myself out of it. For me, the patients and all the things that I have to do during the day don't really stress me out too much. I deal with that pretty well. On the other hand, some of the family members really make me want to throw myself over a cliff. Some of you know what I'm talking about. That's all I have to say. Those type of situations might be on my mind a good part of the day. I might vent to a coworker or my boyfriend, and then I put it away and move on to something more pleasant. That's just what I prefer. If stressing over things made the problem go away, I'd probably do it more. But I'd much rather enjoy an episode of Young and the Restless and go to bed. Well guys, thanks for tuning in to the Nursing Channel. I'll see you next week, okay? Bye!